presentation, we'll review normal gait to assist support workers working in a clinical facing role, supporting prosthetists and orthotists, or PNOs, during gait training. Clinical pathology, or pathological gait, will not be covered in this presentation. This presentation will discuss the concept of normal gait as defined by Perry and look at the different phases of gait. We will discuss how gait is relevant to prosthetic and orthotic gait training. And finally, we will discuss how this information will aid support workers in assisting PNOs during the gait training phase after individuals receive their new device of either orthoses or prostheses. Is typically described in 4 parameters. 1. Stance phase stability, where the foot is in contact with the ground. 2. Swing clearance, where the foot clears the ground. 3. Foot pre-position in terminal swing, where the position of the foot is before it is placed on the floor again. And 4. Adequate step length, which is the distance between one foot and the other during gait or walking. The gait cycle is determined from when one foot strikes the floor to when it strikes the floor again. The gait cycle can be broken down further into these phases, with 60% of the time the foot being in stance phase and 40% of the time in swing phase. Under each of these phases is the process the foot undertakes and will be broken down further on the next few slides. In normal gait cycle, the first movement of the stance phase is defined by the heel striking the floor, and this is defined as the initial contact. The muscles assisting with this is the tibialis anterior muscle, or those at the front of the shin, as highlighted in the diagram. The force or momentum of the body is shown by the dotted line where the blue arrow is pointing. The next stage is the loading response. The force or body weight shifts now to the heel and is demonstrated again by the dotted line as the foot comes into contact with the ground. Here, the quadriceps or front of the thigh muscles are the more dominant muscles during this stage. As the foot loads and goes through mid-stance, the body weight and the primary musculature engaged shifts as demonstrated in figures A, B, and C. You can see the transition of calves and quads through to the calves predominantly involved, and then the abductors and stabilizers of the hip. At the end or terminal stance phase, the body weight again starts to shift backwards as the gastrocnemius and soleus muscles engage and the foot gets ready to leave the ground, as you can see by the heel lifting off the ground. In this pre-swing phase, the toe prepares to leave the floor and the body weight again shifts further behind as the anterior hip muscles or hip flexors begin to stabilize. The initial swing is when the foot leaves the floor. The opposite foot is now in its stance phase. In order for the foot to clear, the knee also needs to bend, and so you can see the muscles crossing the knee joint are also engaging, as well as those at the front of the foot to help with toe and foot clearance. In mid-swing, the foot is preparing for initial contact again with the ground. Finally, in terminal swing, the heel is starting to strike the floor and deceleration of the limb from other swing phase has occurred, utilizing both upper and lower leg muscles to assist. Adequate step length is determined from the heel strike of one foot to the heel strike of the other. For example, the right heel strike in red to the right heel strike in green. The total gait cycle, i.e. left heel strike to left heel strike, is called a stride length, as demonstrated at the top of this diagram. Combining these 4 parameters together, Gage has also added the important 5th parameter, which includes energy conservation and how the body adapts to achieve the phases of gait. This will be particularly important for prosthetists, orthotists, and rehabilitation teams when assessing individuals for their devices and gait training to see where the discrepancies, challenges, and inefficient gait patterns occur. This then brings us to the next question as to how does this relate or why is this important for prosthetics and orthotics? The examples that clinicians and support staff need to ask are, for example, does the device or orthoses assist in improving toe clearance? Does the hip adequately move in flexion or extension, or does it hitch and circumduct to achieve foot clearance, for the example in prosthetics? If not, what do we need to do? Do we need to alter the device in any way, or does the individual need more physical therapy and support? In relation to the role that support workers can play, they may assist in setting up a safe gait training area, assisting the prosthetist or orthotist in gait training and assessment by supporting the patient, changing the gait equipment and area, as well as assisting in fitting or donning and doffing the device during the assessment process. While support workers may not be able to identify pathological changes or impacts in gait, understanding the fundamentals of normal gait patterns will help to progress a support worker's understanding and development in a clinical role within the prosthetic and orthotic sector. The presentation has been designed to help give an overview of normal gait in its most basic form. This will help to underpin the understanding of the different phases of gait and help work towards identifying pathological gait or altered gait in patients that require the use of orthotics or prosthetics. For further in-depth analysis of pathological or altered gait, Mission Gait has a number of wonderful resources and videos looking at gait analysis for a wide variety of conditions. The link for their resource library is in the reference list on the next slide. For further information or to access more learning resources, please go to BAPO at www.bapo.com. This is the PERI reference for gait analysis and the Mission Gait library.